global happenings today. We communicate, we analyze global news. Stay tuned. Hello guys, welcome back to our channel. We're so excited to have you back again. Please, if you've not subscribed to our channel, kindly do so by clicking on the red subscribe button and also on the bell icon so that you can get notification anytime we publish videos on YouTube. All right, we have a news here, and it's a breaking one. Barely 1 week after NCDC has certified Cross River State as the only state that is free from COVID-19, there is so much panic right now as there are 2 cases of death suspected to be related to COVID-19. And this has increased so much fear in the hearts of many people. It was gathered that the patient who is one of the patients who is reported to be a nurse died at the University of Calabar Teaching Hospital, UCTH, while the other died at an undisclosed location in one of the local government, precisely Calabar South local government area of the state. The nurse, who was a staff of the UCTH, showed some symptoms of COVID-19 on Wednesday in the accident and emergency unit of the hospital. A staff of the hospital who pleaded anonymity said he was attending a training workshop organized by the Cross River State government in the management of COVID-19 when some facilitators were excused to go and review the patient. According to the nurse, she said that after the review, it was decided that the nurse be taken to the intensive care unit whilst preparing her for the UCTH isolation center. All the ICU nurses and anesthetists that cared for her have been quarantined. All the nurses that paid her a courtesy visit are also being quarantined. And nurses that cared for her in the accident and emergency unit are not left out. And also another case which the person right now, the victim, is already dead, was in Calabar South local government area. And it was a case of a young man who actually had difficulty in breathing, and it was noticed on Thursday. But unfortunately, the person had already passed on. The state epidemiologist had already been notified about it. Now, the health commissioner has been made the Dr. Beta Edu, and she said that she is in the know of the incident and that the blood sample of the person had already been sent across to Irua in Edo State. And also, the chairman of Nigerian Medical Association, Cross River State Chapter, Dr. Ayu Agam, had also confirmed the story, saying that the health worker who attended to the patient have been asked to undergo self-isolation immediately. This is, really surprising, owing to the fact that just barely 2 weeks ago, they had certified Cross River State as being the only state that NCDC, that's Nigerian Center for Disease Control, can boast of that they don't have any case of coronavirus. And just apart from everything, the governor had been the one ensuring that no case, that's ensuring that the spread of the virus does not come into Cross River State, because of how much he had been able to put into keeping vigilant over the borders of the state. There had been a case where he was seen as late as midnight. He was sitting by the borders when he heard that the security operatives were not doing what they are supposed to do. He had to stay there to see how people will escape into Cross River State. And just some 2-3 days ago, the man had announced that he had lifted ban on public gathering, that's mostly in churches and also in mosques, but did advise that everyone should go in with at least face mask, and also there should be provision by the church, that provision for water and also hand sanitizer to prevent further spread of the virus, if any, in the state. But just amazingly, we are hearing that there are 2 cases now, and the patients have already passed on. And this is really, there's so much panic in the states now. I don't know what will happen, though. I think they are waiting for the result to come out, the result of the nurse to come out, if she is infected with the virus. And if that had happened, being that there had been no such case in Cross River State, it therefore means that they may likely be total lockdown, and everything will return back to what we are seeing in places like Lagos and Abuja. And Cross River State is quite a nice place. I've been there once or twice, and I know so well that if that happens, everybody have to shut down, because the governor does not joke over the lives of the people. And, apart from just that, I think that as at the time, for me, I had believed that it was wrong for NCDC to openly declare them free, because this thing, being that we have porous boundaries, you are not so certain that anything cannot happen. So declaring them free, it will kind of bring about relapse in their security alertness, in being alert over, any invasion of any stranger into the state. So for me, I think it was wrong. They would have allowed them to continue to hold tight till possibly when the vaccine is out, then they can loosen up a little bit. But telling them that they were the best and all of that may have caused a lot of persons not to be, caused security agencies not to be as serious as they were in, stopping people from coming into Cross River State and also going out. And that's the resultant effect of, such relapse. Unfortunately, people are going to pay for it. And I don't know, the state governor has not said anything, about this. But we are hopeful that more lives will not be claimed, because right now the people will be so confused. I'm telling you, a lot of people will be so confused, and it will lead to people staying confined in their houses. And guess what? That particular environment, I'm talking about the accident and emergency unit. In other hospitals, I don't know how it is there, but I believe that in other hospitals, those places are mostly where they receive accidented patients, and possibly because of a lot of issues of emergency coming up, you realize that they seem to be sharing beds. Merely this person is out, another person takes over, and just like that. Imagine, I'm just thinking loud, if nothing, even if they were not so careful, possibly there may have been a change of bed and all of that. And sometimes, when people sleep on their bed, the next day they'll try to see how they can take the clothes off so that it can be washed and all of that. So right now, so many people must be put under check, ranging from the cleaner down to the nurses that paid attention, even those who were sleeping very close to the woman, that's to the nurse. It has to be handled with so much care. Now, for the case of the man in Calabar South who had been infected with the virus, that case also must be dealt with seriously. The resident of that household, I'm talking about the people in that household, the entire household, but whether they are caregivers there, whether they are young children there, all of them must be quarantined. And if there's any possible way of taking them to isolation center, it must be done with immediate effect so that it will not spread. Because the truth of the matter is, if it's not handled with care, the rate of its spread will be serious. Because Cross River State is, though it's not a place that is, it doesn't house so many people, but at the same time, it's a place that people enjoy interacting with one another and all of that. So I think as at this point, Governor Ben Ayade needs to wake up and work real good. For now, we do not really know. We're still waiting to get the exact story. That's the exact story in the sense that we are waiting to confirm if truly the people involved are, COVID-19 patients. If they are, then we must be expecting so much from the state government. All right. And that's where we are going to leave it. Go to our comment section and let us interact. What do you think about the people of Cross River State, considering the fact that they have already relaxed, thinking that this kind of a thing will never come to them now that their own is just starting now? Do you think that there are possible ways that they are going to, put the thing under check? And what do you think may have possibly caused the virus to start springing up in the state, if there are any? And so that let's discuss.